On the mental health of kids and teens, medical experts have new ways to help young people struggling with thoughts of suicide. Aisha's at the First Alert Safety Desk.
Well, Tammy, I'm just getting word a new report will be published in the January issue of Pediatrics. The American Academy of Child and Adolescent Psychiatry just recently declared a national state of emergency in children's mental health. This is especially for young people between the ages of 10 and 24. Here's some of that new guidance in the clinical report. It's good for both pediatricians and parents to know this morning. Suggestions for intervention include personalizing coping strategies for patients, those kids that are struggling. Also during preventative care visits, looking at the potential access to any deadly devices, especially firearms. Another recommendation is to engage parents and families in suicide prevention as well as treatment. For example, sleep hygiene or community engagement. School-based interventions are also important. It talks about that in this report, educating students and staff on recognizing signs of depression. During the pandemic, emergency room visits for suicide attempts amount spiked, especially for young girls. There is an online blueprint for youth suicide prevention. We'll have a link for you at WBAY.com. Coming up in the next half hour, before gathering with loved ones for Christmas and New Year's, doctors are urging you get vaccinated for respiratory viruses as we see cases and hospitalizations ramp up in the U.S. Steve.